Now, by all accounts, for those of you who've been around a while, the predictions of doom, death, and destruction for the health system have been iterative for the last 30, 40 years. It's all coming to an end. It's all going to hit a brick wall. We can't afford it anymore. It's going to take all the budget if we don't do anything, et cetera, et cetera. And somehow we get through, and then we get through, and then we get through. And sometimes there are leaps in terms of major changes in terms of reform. But the reality is, the system has been remarkably adaptive in times of considerable resource stress and demographic change, which has changed the way we all provide care in the system and continues to do so. And in fact, the main reason that we're still a functioning health system really is because all of you and because of constant innovation. Tiny little things that happen every day that just change the way you do things. And we're able to do them better, more efficiently, and we never save money in healthcare, but we redirect it into other things. So the reality is we're standing on the shoulders of others. And so this isn't just a rah-rah token event to kind of falsely promote innovation, in a sense, for the sake of it. This actually recognizes that the system rests on innovation. Without it, we wouldn't actually be here today. But the issue is when you actually recognize it, small innovations can spread and things can move more quickly. And that's part of what today is about. It's celebrating the work that you have all done, the risks you've actually taken, because you do take risks when you innovate, and in a sense, as long as it's safe for patients in the community, permission to fail. And it's that celebration of guts and courage and good thinking that we're here to celebrate today. And to add to that welcome, it gives me great pleasure to welcome the Honourable Jillian Skinner, who's Minister for Health and Minister for Medical Research.
Thank you very much indeed, Norman. May I pay my respect to the traditional owners of the land, to elders past and present, and thank you, Donna, as always, for a very warm welcome to country. I wish to acknowledge my parliamentary colleagues. I think the Premier is just about due to be here. The Honourable Kevin Humphreys, Minister for Mental Health and Healthy Lifestyles, to Director General Dr. Mary Foley, to keynote speaker Professor Robin Ward, who's a Professor of Medicine at Prince of Wales Hospital and one of my great clinical heroes, to Dr. Norman Swan. Thank you, Norman, for again being our Master of Ceremonies. And I wish to welcome and acknowledge all attendees from board chairs, board members, chief executives and other staff from local health districts, from our pillars, from Medicare locals, medical colleges and universities, to health consumers and many other organisations, and particularly Baxter Healthcare, who have been major sponsors of the Health Awards for a very long time. It's my very great pleasure to add my welcome to you to the second annual New South Wales Health Innovation Symposium with the theme Innovating Care Every Day in Every Way. Encouraging innovation is a key part of my vision as Health Minister. It's why I'm pleased to be the country's first dedicated Minister for Medical Research, and why I'm always excited when I discover new models of care and visit workplace cultures of innovation. As Norman has said, innovation is not new to the health system. For over 140 years, New South Wales Health has been providing health services for the state that had to constantly adapt to the system to suit new challenges and new treatments. It is a place of innovation. But today the pace of change in technology and society is speeding up. Our population is growing and ageing. Lifestyle diseases are more common. The people we serve are demanding much more from us. They expect different models of care, a better quality of care. They want it all. They want better, shorter, faster, more care. They want more interactive care. They want it tailored for them, and increasingly they want it where they live. So these are challenges, and innovation can impact the most straightforward, seemingly minor interaction through to the most significant clinical breakthrough. Innovation is about the curiosity and the ambition to do something better. It can save lives, it can save money, it can save time. And as Norman has said, it frequently requires courage, because innovation by its name is new, doing things in new ways. On my rounds of the health system since becoming health minister, I visited many, many hospitals and other health services across the state. I meet people on the ground who are coming up with innovative programs making a huge difference to people's lives. I could mention many of them, and you'll hear of many of them over today's seminar and tonight's awards. I just want to tell you a story about one patient I met this week whose life has been transformed by the new paediatric pain management clinic started at John Hunter Children's Hospital this year. She is the face of what we are all about when we talk about innovative care in the New South Wales health system. Could you throw up her photograph? This is from the Newcastle Herald yesterday. The little girl is Ivy Tregenza. She's 7. She has a rare and complex condition, and she must have a weekly infusion to keep her well and alive. She will need them for the rest of her life. But she's been so traumatised by this medical intervention, by the early infusions, that she'd had to be anaesthetised and treated in an operating theatre, which of course were very much in demand for other patients. No, not ideal, as was pointed out by Professor Trish Davidson, the amazing director of the Hunter New England Children and Young People's Health Care. And it's the constant search to do it better that enabled this program to get up and running. It's part of the pain program that we launched earlier last year. And what they've done with Ivy, a whole team of paediatric pain management clinicians, doctors, nurses, psychologists, occupational therapists, using play acting and other interventions. Young Ivy doesn't have to go to the operating theatre anymore. In fact, she helps the team do the infusion. She does the infusions on her baby doll while they do it on her. And her mother, I can tell you, she was there with us. We all shed a tear. It's a miraculous story about how innovative care has transformed the life of this little girl, Ivy. How could you not love her? Look at her. Look at that smile and what it's meant to her family and her twin brother, who don't have to share the pain that she was sharing. So it's a constant search to do it better, like the team in John Hunter Children's Hospital, that gives innovation such a powerful impact in our system. Today's symposium features 60 presentations of innovative health programs and services from across the state. Some of them are among the 38 finalists for tonight's New South Wales Health Innovation Awards, and I know you share my excitement about the day and the night in prospect. All of us can be educated and inspired by the power of ideas, and I hope that this symposium and tonight's award is about sharing the ideas so that we can spread them far and wide. Thank you all for your involvement, and congratulations.